How have you been feeling?
Pretty good.
For a patient with no obvious neurologic problems, perform a screening of her mental status or cognitive function.
Let's go.
Begin by assessing physical appearance and behavior during the health history. The patient should have good hygiene and be well-groomed and appropriately dressed. Also observe the patient's body language. She should have erect posture and make eye contact, and her facial expression and movements should correspond to the situation. Next, evaluate the patient's cognitive abilities, starting with her state of consciousness.
Would that be all right?
Sure, that'd be fine.
Okay. What's today's date?
Today is Tuesday, December 7th.
Good. And your full complete name?
The patient should be oriented to time, place, and person, and be able to respond appropriately to questions and the environment.
My next questions show how you make comparisons.
Also ask her to describe analogies, moving from simple to complex ones.
Instruments.
Good. Now try and complete this sentence. A cat is to a kitten as a dog is to what?
A patient with average intelligence should be able to respond correctly.
Between a rowboat and a cruise ship.
Well, there are
To
several
continue,
differences.
test
Rowboat is quite
abstract
small,
reasoning.
And a cruise ship is very large. The rowboat has no engine. A cruise ship does.
Very good. Now, tell me what this proverb means. A bird in the hand is worth two in the bush.
If you have something good, don't
The
throw that
patient
away
should be
because
able
it's
to
bad.
interpret the phrase adequately.
Good.
Next,
Now,
have the
I'd
patient
like you
do
to do
simple
some
arithmetic
math for me.
to assess cognition and attention span.
I'd like you to subtract 7 until you reach the number 8.
Okay. 50, 43, 36, 29.
She should complete the
22,
calculations with few errors within 1 minute.
That sounds right to me.
Also test the patient's ability to write her name and address, or a dictated phrase, which she should do with no errors or omissions. Or ask an older adult to draw a clock face. Two or more errors in the drawing suggest cognitive impairment.
Good. Could you
Next,
please repeat
assess
the series
memory,
of numbers?
beginning with immediate recall.
7, 16, 1, 4, 13, 11, and 6.
7.
The patient
16,
should be able to
1,
repeat 5 to 8 numbers
13,
forward
11,
or 4 to 6 numbers backward. Then test recent memory.
Now I'd like you to look at these 5 items and remember them. I'll ask you to recall them for me later.
Okay.
After 10 minutes, the patient should recall all the objects. Also check remote
Are you
memory
ready to go on?
by asking about verifiable past
Bring David
events.
these. And can you tell me your mother's maiden name?
Her maiden name was Jackson.
Okay.
The patient should answer your questions correctly.
Sure. Parkwood High School.
Move on to determine the patient's
to ask you some
judgment,
questions
for
to
example
show
with
you-
hypothetical situations.
Tell me, what would you do if you found a stamped envelope lying in the street?
I would pick it up and drop it in the nearest mailbox, or I would take it directly.
The patient should provide reasonable responses. To continue, assess emotional stability
pretty good.
by observing the patient's mood and feelings through her verbal and nonverbal behaviors.
Of moodiness or other
The patient should express feelings that are appropriate for the situation.
But usually I come home, take a brisk walk, or play with my grandchildren and things.
As you talk, note the patient's thought patterns and content. Her thoughts should be easy to follow, with no perceptual distortions. Her ideas should be logical and goal-directed, and her behavior should reflect the emotional content of your discussion.
Doctor's office more information about the diabetes.
Finally, listen closely to the patient's speech and language skills. Her voice should have inflection and be clear and strong with a range of volume. Her speech should be fluent and articulate. She should be able to follow simple instructions and express her thoughts clearly.
To help my daughter and the baby to stay as healthy as possible.
In a child, speech and language should be age appropriate, and speech should become more understandable as the child grows older.
Drinks?
Also, complete your test of the patient's recent memory.
Change, let me ask, do you remember those 5 items that I asked you to remember?
I think I can.
Okay.
There was a blue pen. There was a cotton swab. There was a quarter, a paper clip, and a gold key.
That's correct. Very good. All right, now
Now examine the cranial nerves by testing their motor and sensory functions as appropriate.
Okay.
Although smell and taste usually aren't tested unless a problem is suspected.
Smell, is that okay?
That's fine.
Okay.
Begin by evaluating the olfactory nerve, or cranial nerve 1.
Now I need to press one nostril closed. Can you still breathe?
Yes.
Okay. What I'd like you to do is close your eyes
Okay.
and tell me what you smell.
Smells like rubbing alcohol.
That's correct. Now I'd like to check the other side.
The patient should perceive the odor on each side and identify it correctly most of the time.
That smells like coffee.
Next, assess the optic nerve, or cranial nerve 2. To do this, test distance vision with a Snellen chart and near vision with a Rosenbaum chart, as in the eyes video in this series. The patient should have 20/20 vision.
And read the smallest line possible from left to right.
63925.
That's correct.
Also, test the visual fields by confrontation. The patient's peripheral vision should be comparable to yours.
Say now when you see my wiggling fingers move into your line of view.
Now. Now. Now.
Now test the oculomotor, trochlear, and abducens nerves, or cranial nerves 3, 4, and 6 together. As in the eyes video, assess these nerves by inspecting the eyelids, which should have no drooping, and by checking the pupils, which should be equally round and reactive to light and accommodation.
Thank you. I'd like you to look straight ahead and follow my moving finger with your eyes, and don't move your head.
Okay.
Also evaluate the extraocular muscles by having the patient watch your finger move through the 6 cardinal positions of gaze. Eye movements should be well coordinated and full, with no jerking or drifting. Next, assess the trigeminal nerve, or cranial nerve 5. To do this, inspect the facial muscles, and then have the patient clench her teeth while you palpate her jaw. Facial expression tone should be symmetric, with no atrophy, tremors, or fasciculations.
And relax.
For a young child, watch for bilateral jaw strength as she eats a cracker. To assess any cranial nerve in a child, modify your technique as needed, for example by playing a game.
Good.
I need to check the sensation of your face. May I have your hand, please?
Yes.
I'm going to touch your
After
hand.
demonstrating sharp and dull sensations with a paper clip or broken tongue blade, have the patient close her eyes. Then touch each side of her face on the forehead, cheeks, and chin,
Sharp.
randomly testing sharp and dull sensations, which the patient should identify correctly.
Sharp. Sharp.
Thank you. Now I'm going to check the light sensation on your face. When you feel the cotton wisp, please say now.
Also, randomly stroke
eyes
the
again.
same areas with a brush or cotton
Now.
wisp, and have the
Now.
patient say when the stimulus is felt.
Now.
She should feel this light
Now.
touch in all areas.
Now.
Thank you.
Then check the corneal reflex. With the patient looking up and away, lightly touch one cornea with a cotton wisp. Then touch the other.
Look up and to the left.
Both eyes should blink symmetrically, though patients who wear contact lenses may have a diminished
turn your
or
chin to the
absent
left.
reflex.
And look up and to the right. Thank you.
Next, assess the facial nerve, or cranial nerve 7, along with the glossopharyngeal nerve, or cranial nerve 9. Observe the patient as she makes specific facial
I'm going to ask
movements.
you to make several movements, okay?
All right.
Can you raise your eyebrows and wrinkle your forehead? Good. And smile, but don't show your teeth. And puff out your cheeks. Good. And purse your lips like you're going to whistle. And show me your teeth.
All movements should be
And
symmetric,
close your eyes
with
tightly.
no tics or drooping.
You can relax.
To assess
Now I need
taste,
to do a
use
taste
4
test.
flavored
I'm
solutions.
going to put a drop of solution on your tongue, and I'd like you to tell me what it tastes like.
Okay.
Can you stick out your tongue and hold it there, please?
Apply a solution to the side of the tongue and wait for the patient's
Can you tell me what
response.
that is?
Sour.
Good.
Then offer a sip of water and test
you.
another solution. The patient should properly identify each taste.
Okay, we're going to try one more time. Please stick your tongue out and hold it.
To continue, evaluate the acoustic nerve, or cranial nerve 8.
Now
As
I'd like to
detailed
check
in
your
the
ear.
ears, nose,
Can
and
you put
throat
your
video
finger
in this
your right ear
series,
and wiggle it?
perform the whispered voice
Repeat
test.
what I whisper, please.
In each ear, the patient should hear the words you whisper from 1 to 2 feet away.
Purple. Ball game.
That's correct. Now I'd like to check your other
Next,
ear.
do the
Now I'd
Weber
like to place
test,
this tuning fork
in
in
which the
side of
patient
your
should
head.
hear the vibrating
Tell me
tuning
if
fork
you're equal
equally in
both
both
ears
ears
or
with
better
no
than
lateralization.
Equally in both.
Thank you.
Also perform the RIN
Now I'm
test,
going to place
in
this
which the
behind your
patient
ear.
should hear the
Please hold it
vibrating
when it
tuning
stops.
fork by bone conduction about half as long as by air conduction.
It stopped.
Can you still hear it?
Yes.
Please tell me when it stops.
It stopped.
Thank you. Now we'll check your other ear.
An older adult is likely to have conductive or sensory neural hearing loss, which can alter the results of the Weber or RIN tests. Now check the glossopharyngeal nerve further, along with the vagus nerve or cranial nerve 10.
Now I need to check the back of your throat.
To
Can
test
you
these
open wide,
nerves,
please, and say,
inspect
"Ah"?
the soft palate. The soft palate should rise symmetrically, and the uvula should be midline. Next, assess
need
the
to check
gag
the gag
reflex.
reflex. Can
When
you
you
open
touch
wide,
the
please?
posterior wall of the pharynx, the patient should gag, and the uvula should stay midline. Then have the patient drink some water
Now take
while
a
you
few
observe
sips of
her
water.
ability to swallow.
And swallow. And again.
The patient should swallow easily, with no water passing back through the nose. Also consider the patient's
Great.
speech.
How did that feel?
I had no problem swallowing.
You should hear no hoarseness,
No, thank you.
nasality,
Quite enough.
or difficulty with guttural sound. Now test the spinal accessory nerve, or cranial nerve 11. To do this,
need to check your
evaluate the
neck.
size, shape, and strength
ask you
of
to
the
make some
trapezius
simple
and
movements.
sternocleidomastoid muscles.
Is that okay?
Yes.
And shrug your shoulders up. And don't let me push them down.
Okay.
The shoulders should rise symmetrically.
Good. And relax. Now turn your chin to the left and press against my hand.
In both directions,
And now
muscle
turn your
strength
chin to
should
the
be
right
symmetric and full.
And press against my hand.
Finally, test the hypoglossal nerve, or cranial nerve 12, which is usually tested with cranial nerves 9 and 10.
I need to look at your tongue, please, when it's relaxed and when it's moving. Could you open your mouth and stick out your tongue?
The tongue should be symmetric, with no fasciculations, atrophy, or deviation to either side.
And move your tongue from side to side. And curl it up like you're trying to touch your nose. And try and touch your chin. Very good, you can relax. Last of all, I need you to press your tongue against your right cheek,
The patient's tongue should have full muscle strength on both sides.
and now your left cheek. And relax.
That seemed like a pretty thorough exam I've had here today.
Again, listen to the patient's speech. She should have no difficulty pronouncing lingual sounds, such as L, T, D, and N. Even though the neurologic system is highly complex, with the right questions and examination techniques, you can assess your patient's mental status and cranial nerves with ease. And when you consider these findings with those from your examination of the reflexes and motor and sensory systems, you'll be able to judge your patient's neurologic status fully and accurately.